Hi everybody. Today I'm gonna be doing my presentation on Terri Schiavo. I'll be talking about the ethics behind the case, along with the background behind the case and the controversy that followed up with the case. Case study background. On February 25th, 1990, Teresa Marie Schiavo suffered from a cardiac arrest which was caused by an eating disorder induced by hypoklemia, which refers to a lower than normal potassium level in the bloodstream. With this, a severe case of anencephalopathy followed her cardiac arrest or a chronic brain injury that starts with the cessation of cerebral blood flow into the brain tissue. This often occurs due to a lack of oxygen. As police were called into the investigation, they found no evidence of any type of physical abuse or struggle at Terri's physical examination. Severe agnostic encephalopathy ensued. Several months after the incident, computed tomography revealed severe atrophy of both cerebral hemispheres, and electroencephalography showed no evidence of cortical activity. Seeing no progress in her condition, Michael Schiavo, Terri's husband, was appointed as Terri's formal guardian on June 19, 1990 by the court. Even with her current state, Michael Schiavo received nursing training to facilitate Terri in their home. However, this proved too overwhelming, forcing him to return her to a chronic care facility. Michael's constant efforts to return Terri to her normal state led to him moving Terri to several facilities, along with exposing her to several treatments, which resulted in no progress. Background continued. With this, Terri was eventually stabilized into a vegetable state, or when a person, due to head trauma, is driven into a state of chronic brain dysfunction where a person cannot do things that require conscious intention. Even though doctors constantly administered both standard and experimental therapies to help Terri, such as experimental thalamic stimulator implant treatment paired with intensive physical, speech, and occupational therapy recover for 3 years, none had any effect towards her recovery. Seeing no progress in her condition, Terri's husband, Michael Schiavo, finally accepted the chronic diagnosis of her neurologist, who explained that her condition was irreversible. With this, he decided to take her off any life-sustaining machinery, especially because of a statement that Terri herself made in the past, explaining, quote unquote, "I don't want to be kept alive on a machine," end quote. Controversy behind the case. Due to Terri's condition, there was a clash between her husband and her parents. Her husband wanted to suspend any life support machinery that was hooked up to her, while her parents rejected the diagnosis given by the neurologist and believed that there was a chance that Terri would get better. This led to her parents petitioning to remove Michael Schiavo as Terri's legal guardian, but the court quickly dismissed the case due to no basis behind the removal. On May 1998, Michael Schiavo requested the court's permission to remove Terri's PEG tube. The removal of the PEG tube would ultimately lead to Terri's death because the PEG tube is a tube inserted through the wall of the abdomen directly into the stomach. It allows air and fluids to leave the stomach, and it can also be used to insert drugs or liquids, including liquid food, to the patient. The Schneiders, or Terri's parents, opposed, asserting that Terri would have been chosen to remain alive. Consequently, the court appointed Richard L. Pierce as a second guardian ad litem to represent Terri's interests. In December 1998, Pierce submitted a report acknowledging Terri's persistent vegetable state, PVS, with no prospect of improvement according to her doctors. Pierce also found that Michael's testimony about Terri's wishes to be insufficient under the clear and convincing evidence standard mandated by legal precedent and Florida state law. He also raised concerns about Michael's potential financial conflicts of interest. However, Pierce suggested that if the court disagreed and deemed Michael's evidence sufficient, the feeding tube should be removed, out of fairness to Michael. Over 7 years of legal battles resulted in 30 legal opinions, along with this court case, all endorsing Michael Schiavo's decision making authority on behalf of his wife. Eventually, the court sided with Michael, and Terri's tube was eventually removed, which quickly led to her death in about 13 days, her death date being March 31st, 2005. Ethics slash who should decide. Disagreements within families regarding the care of a loved one are unfortunately common, and similar cases will likely arise in the future. Family members are bound by a duty to care for one another, and legal interventions, which often designate one family member as the primary decision maker, can exacerbate tensions. Therefore, legal avenues should be pursued only as a last resort. Regular meetings between the healthcare team and the family can help ensure everyone is informed and involved in the decision making process. In the event of a dispute, it's crucial to recognize the moral role of all family members in advocating for what they believe is best for their loved one. Times for the family to reach consensus, therapy trials with clear goals, negotiation, and attribution can all aid in resolving disputes. However, some conflicts may ultimately require legal intervention, as demonstrated by the Terri Schiavo case. Such interventions can come at a significant emotional cost, resulting in both the loss of a family member and a fracture of familial bonds. Here's a before and after of Terri before the incident and after. Before the incident, she was about, well, at least in this picture, she was about 25 years old, and we could see she's very healthy. She looks fine. But after she had her cardiac arrest, and following symptoms occurred with her brain trauma, we could see we could see a drastic difference. Conclusion: the Terri Schiavo case was a highly controversial and emotionally charged legal battle that captivated the nation in the early 2000s. Terri Schiavo was a woman who fell into a persistent vegetative state, PVS, in the 1990s after suffering cardiac arrest. The central conflict arose between her husband, Michael Schiavo, who believed she would not be wanted to be kept alive in that condition, and her parents, Bob and Mary Schneider, who fought to keep her on life support. The case involved complex legal, ethical, and moral considerations regarding the right to die, the role of guardianship, and the sanity of life. Ultimately, after years of legal battles and political interventions, Terri Schiavo's feeding tube was removed in 2005, leading to her death by dehydration after 13 days. The case sparked national debates about end of life care, the importance of advance directives, and the appropriate role of government and judiciary in such personal and sensitive matters. It also highlighted the need for individuals to communicate their wishes regarding medical treatment through advanced directives like living wills or healthcare proxies. In conclusion, the Terri Schiavo case remains a poignant reminder of the complexities surrounding end of life decisions and the importance of respecting individuals' autonomy and wishes, even in the face of profound disagreement and controversy. Research resources. Here are the sources that I use in order to acquire the information needed to learn about the case. And yeah.